Welcome to Medicas video podcast, everyone. Ladies and gentlemen, my name is Varun. This is yet another important subject that we will discuss today, especially for those who have been suffering with sinus infections or sinus related problems. So, to discuss this subject today, we have Dr. Rajesh Bharadwaj. I'm sure a lot of you must be knowing about him already. Dr. Major Rajesh Bharadwaj has been graduated from Armed Forces Medical College, Pune in 1982. He has got 30 plus years of experience, especially when it comes to ear, nose, and throat related medical conditions treatments. He had served in Indian Army for 15 years, where he gained vast clinical experience as an ENT specialist. He has served in the largest and the busiest hospitals of the armed forces, including command hospitals at Pune and Chandigarh, and at the Army Hospital, Delhi Cantonment. Dr. Bharadwaj earned his blue and white striped Siachen Glacier medal for his long stint on the Siachen Glacier in 1984 and was the first medical officer to complete his tour of duty without being medically evacuated. He has also served at Jaffna, which is from Sri Lanka, during the peacekeeping mission and was in charge of the battle casualty ward, where his skill as a surgeon and hardiness of a soldier were put to the test while handling many casualties on a daily basis. Dr. Bharadwaj is working at MedFirst ENT Center based out of New Delhi. Those who are around the Delhi region who are having these issues with respect to ENT, because if we have to name the medical conditions related to ENT, there are a lot. So Dr. Bharadwaj is one of the best and the finest specialists and also a surgeon available in our country, especially when it comes to the ENT related subjects. Dr. Bharadwaj, thank you so much for joining us in today's session, sir. Namaste
Thank,
and welcome to our
thank
session. Dr. Bharadwaj, there is one important and a common medical condition which most of the general public will face is sinus related infection. So I'm going to go straight into the important question which many of our viewers have. How can I quickly get rid of the sinus problem?
thank you, Mr. Varun. Thank you for having me on this platform, and I'm
Pleasure is ours.
grateful. And I'll try to do my best to answer our viewers' queries. So, first of all, the one clarification I wanted to make was, and of course, explain. So, sinuses or sinusitis is a term very commonly used, but most people do not understand what is the difference between the nose and the sinus. So, the
Okay.
nose is the structure that we see over here, is the midline structure that we are all familiar with, divided into the right and left cavities, which is the right nostril and left nostril. And surrounding the nose all around are air filled cavities, which are actually the correct terminology is paranasal sinuses, PNS. So you have maxillary sinuses on your cheeks, you have ethmoid sinuses in the eye, just around the eyes, you have frontal sinuses on the forehead, and you have sphenoid sinuses, which are right there on top of the head, on the vertex of the head. So sinuses are air filled cavities around the nose, and their role is to give your voice some resonance and to give it a better quality, as well as probably to lighten the weight of the skull and the face, which is already very heavy, because human beings brains are much heavier than other mammals before us. So the paranasal sinus gets affected through the nose. So the
Okay.
problem that you have is usually a rhinosinusitis. Something goes wrong with the nose, and if it does not come under control, it travels to the sinuses, a condition called sinusitis or rhinosinusitis. One of the common misconceptions that people have is to mistake a common cold for a sinus infection, and they will come to you to say, Doctor, I have sinus. And quite often we find they do not have a sinus issue at all. They may be having some nasal allergies, they may be having just a simple common cold, because the sinusitis, as we will deal with this topic, has got significant and very clear symptomatology, which makes it easy for us to diagnose. So, the question is, the sinusitis by itself is a common problem. It is usually related to a cold and can be diagnosed and managed easily with over the counter medication sometimes with a visit to a doctor or a specialist, and quite often with simple home remedies.
Right, right. Thank you for the clarification, Dr. Bharadwaj. Now that we understand sinus is not actually a problem, it's they're actually air cavities that are there, around our head in multiple places. So only when it gets infected is when it irritates the human being, and that's when we need to seek help from the ENTs like you. Dr. Bharadwaj, I have been observing and I have been seeing a lot of online material where various doctors are actually demonstrating some sort of stunts to quickly release the sinus problems. So is there so for because see in for a patient like us, and I'm a layman and I'm a patient, before I even go to a doctor, I want to immediately get a relief from a problem like sinus. Is there a quick thing that I can do, like pushing my cheek like this or opening my nose like this in order to get a quick relief from sinus problem, Dr. Bharadwaj?
So, Varun, we'll tackle two things together in this question.
Sure.
Apart from quick relief, we will also mention about how people can get this treated at home. So, what is the ready and easy home remedy available for patients? First of all, they must understand if they have a simple cold or a allergy, the treatment would be different because the symptoms are sneezing and clear discharge. But if they have a sinus related problem, the best thing for them to do is to do steam inhalation. Steam
Okay.
inhalation is easily available. There is no equipment that is required. Even a normal bowl utensil in the house is enough to boil some water and cover your head with a towel, large towel, or with a blanket, and breathe in that air through your nose and throat for about 5 to 7 minutes. The way steam works is it reduces the stickiness of the mucin, which is the discharge in the nose, which is causing congestion and blockage. And when the steam particles go in, they dislodge the stickiness of the mucin and the mucus, makes it easier for the patient to blow out and clear the secretion, so they feel less congested and they feel better. So steam inhalation can be done at any given moment if they have a sinus problem. Other issues now, for instance, you were talking about lifting up a nostril. Lifting up a nostril, actually, there is a technical word for it called the Cottle test. That is, if your nasal septal deviation is there, so if your nose bone is deviated to one side of your nose is blocked, and there is a natural tendency for you to lift that because that passage is compromised to some extent, and you're physically lifting up and trying to open up a passage, it is possible in this instance you might require an ENT consultation and a surgery might help. But
Okay.
the one warning or one thing I wanted to tell our patients and viewers is something for them to be careful about. In the presence of a sinus infection, when you have a nasal congestion with purulent discharge inside, do not do jal neti or nasal douching. There is a natural tendency to do nasal douching to help clear up nasal passages, but we strictly advise against it in the presence of an infection. And we have seen multiple instances where doing this kind of activity propels the infected material into the ears, into the other sinus, and
Okay.
spreads through the nose. So it can cause more complications than it can serve. So, in the presence of an acute sinus infection, our advice and our recommendation is not to do jal neti or nasal douching. Do not avoid doing any nasal washing at that time. It can be done subsequent to the time when your sinus infection has settled, when there is no pain, and when the pus or purulent discharge has stopped coming. Then you can definitely do nasal douching, and you can do it at home, and it's very easy to do.
Great, great. Thanks for the clarification, Dr. Bharadwaj. This was actually a big misconception which all of the patients have. There is one question I want to ask in the explanation what you had given. You asked us to conduct steaming or steam inhalation. There is again another misconception which most of the elders or the families have is what do they add in that steam? Can I add some cloves? Should I add some garlic? How about some turmeric? How about some different kinds of herbal leaves or herbal medicines? Is that actually necessary, or will that help, or will that aggravate the sinus, Dr. Bharadwaj?
So it's a very good question, Varun, and I'm glad you brought this up because this is quite often in patients' mind. So first of all, the thing that works is steam. Adding anything to the steam like camphor, eucalyptus oil, various other additive materials actually is just a flavoring agent.
Okay.
Now, if you are comfortable with that, if it makes you feel better, it is all right. Our recommendation is to use only steam because
Okay.
many of these patients have accompanying allergies. So, if you
Okay.
add strong smelling agents, it is possible they may react to the steam and they may
Okay.
cause more of a problem and congestion, including sneezing and watering discharge from the nose, because the strong chemical that they have used in the steam may disturb the nasal mucosa from inside. The
Right.
other rider that we want to place over here is that steam inhalation usually works for people, but if you have an allergy to humidity, if hot, humid air makes you feel allergic, and if your nasal congestion increases, then you should avoid steam inhalation. There is a small minority of patients who do not respond well to steam. Many of these patients will tell me, Doctor, I can't take steam, it makes my condition worse. In which case, it is sensible to avoid steam because it is not working
Okay.
for you.
Okay, okay. Thanks for the clarification, doctor, because this is extremely an important and a common question which most of them, even though they know the answer, they continue to do it. So, Dr. Bharadwaj, when they have these sinus problems along with this steaming, some of the people would want to use this Amrutanjan, Jandu balms, Tiger balms, and they want to add, apply it around their nose or their eyes or their, when I say around their eyes and head and all. Does that actually help?
So, Varun, technically speaking, I'm not supposed to answer this question because the government and all of us are very clear about cross-pathies. Cross-pathies is the kind of art or the malpractice where a doctor trained in one system of medicine is trying to give advice or recommendations from another system of medicine.
Okay,
It is like an
okay,
Ayurveda prescribing an antibiotic or giving an injection because it is
right.
not part of Ayurveda treatment or not part of
Right.
Ayurveda teaching. But it is easy to enough to answer these. Again, as I said, these are strong smelling agents. But if it gives you relief, there is no reason they are harmless. If it makes
Right.
you feel better, there is no reason for you not to indulge in it or not to. If it makes you feel better, please use it.
Absolutely. Thanks for the clarification, doctor. How about a situation or a question that people usually ask? I get sinus. That's it. It's like a chronic disease and have to live with it for lifetime. Is it true or is it false, doctor?
So we have various treatment modalities for a person who has chronic sinusitis. And quite often they have a predisposing cause. So it's either an allergy is or a nasal septal deviation. Many of them, because of allergies, have polyps in their nose, which also predisposes them to a sinus infection called sinusitis. So first we determine whether they have a chronic sinus infection. We determine the cause of the sinus infection. Quite often they can be treated. There are certain diseases where the ciliary movement of the nose may be affected, like cystic fibrosis, in which case the patient may have a congenital deformity and a predisposition to developing a sinus problem. We test for all that. We give sometimes endoscopically guided, we take a nasal swab, we take a pus swab and send it for testing to find out what is the bacteria and what bacterial agent will work, antibacterial agent will work against it, and we give that treatment. Sometimes simple drainage procedures may be required, and rarely and occasionally a patient who has chronic sinusitis may benefit from a surgical treatment in which we clear up the sinuses, we open up drainage passages for the sinuses so that the patient gets more permanent relief. So sinus or sinusitis is easily treatable. The problem we struggle to treat with usually is allergies. Those also now, because of our allergen immunotherapy and allergy vaccines, those are also now more easily treatable.
Right, right. Thank you, Dr. Bharadwaj. Dr. Bharadwaj, this sinus as a problem, right? So, how do I make sure that I do not get, what do you call, or probably infected with the sinus? Are there any precautionary measures?
So, first of all, a healthy lifestyle. That means good nutrition, good hydration. To maintain healthy sinuses, hydration is very essential. Avoid polluted and smoky areas. If you have to go out in such places, make sure you wear a mask. If you have simple allergies, get those allergies treated with simple anti-allergic treatment or with a nasal spray. You can use gel nethi or nasal douching as a precaution because this keeps your nasal passages clear, removes all the crusts, removes the dust particles, and also reduces your allergy predisposition. There are certain protective allergen gels also now which are available, which you can use if you're going to dusty and smoky areas. So basically, there are various modalities available to keep your nasal passage safe and clear from disease. And nasal douching and steam inhalation are two. But maintaining a healthy lifestyle and hydrating yourself well will also help.
Great, great. That's actually very informative in order to make sure that we don't fall prey for this sinusitis problem, Dr. Bharadwaj. So for those people who feels that, hey, sinus is not a big problem, can you probably throw some numbers or stats or, your experience in terms of the number of people that you're encountering on a daily basis who are having this sinus kind of problems? How big is this sinus problem in our country, Dr. Bharadwaj?
See, sinusitis as a condition is has been around. The prevalence has pretty much remained the same for years together. Wherever conditions are cold and humid, so sinusitis in a place like UK is very prevalent because the
Okay.
climatic conditions predispose them to sinus infections. Now,
Okay.
climatic conditions, particularly hot tropical climate, usually does not cause very serious sinus problem. But in the
Okay.
winter months, we are more like, particularly in North India in the winter months, we are more likely to have serious sinus infections. And in children, especially if they get a cold, which gets complicated because children's sinuses are very wafer thin walls, and the infection can travel rapidly from one sinus to the other and to the other parts of the surrounding areas and cause serious complications sometimes. So, yes, sinusitis can and does cause serious complications, but it can be easily treated and is not a cause for great concern.
Right, right. Dr. Bharadwaj, see if how do I know? Let's say I'm already a patient who's suffering with sinus. I already know that. How do I know when I should go to a doctor, or up till what extent can I handle my condition at home?
If you've been handling your condition at home for 5 to 7 days, and in spite of that, you have fever, sometimes high grade fever, you have thick yellowish discharge, if you have nasal bleeding, if you have cheek pain and headache, if in addition to that, you develop pain in the root of your teeth, you have severe and very thick and profuse post nasal drip going down into your throat, and if you have a chronic cough related to a sinus related problem because of the post nasal drip, these are indications that you should visit your specialist.
Okay, okay, great. So until so then that's definitely there is no go. You have to go to a specialist. Otherwise, it will get more aggravated and it's going to affect your other organs in your body as well. Great, thank you, Dr. Bharadwaj. I believe we have covered most of the questions that are prevalent, commonly asked, especially around the sinus. So, ladies and gentlemen, all of you who has or who wants to be aware of these sinus related problems, please ensure that you take the precautions from ENT specialists like Dr. Bharadwaj. So he will be available on our platform for also consultation. So Dr. Bharadwaj can be found on www.medicasapp.com. You can see the scrolling at the bottom. You can also download Medicas app from Play Store and App Store. Find Dr. Bharadwaj. Have an online consultation. Those who are not around Delhi, because I know it's very difficult for you to travel and especially in your busiest times. So it's always good to have a doctor in hand, especially on your phone on an app like Medicus. So find him on our platform and connect with him and get your questions answered. Dr. Bharadwaj, thank you so much, sir, for your time and for your experience in sharing with us related to sinus problems. We shall connect one more time for another subject. Until then, thank you so much, ladies and gentlemen. Namaste, Dr. Bharadwaj.